Hey, Dr. Birchfield from the Chiropractic Health Center. Obviously, as a chiropractor, I deal with a lot of people that are having pain, and that's most common reason people go to the chiropractor is for pain. And pain has multiple factors involved in that. A lot of times, there's a mechanical element to pain, tension, compression, those kind of things. There can be tissue breakdown, so you can then have cartilage worn out, cushions worn out, things rubbing, grinding, causing tissue damage that then lead to chemical mediators that produce pain and things. So there's multiple factors involved in this, but something that comes up pretty common is people are taking medication for pain, and commonly they'll take NSAIDs or non-steroidal anti-inflammatories or things like aspirin or whatnot for pain. And one thing that is commonly comes up in conversation with somebody is a lot of people would like to not take medicine. Some people are aware of a lot of the negatives of those medications. Other people are not that aware. They might think it just makes pain go away and there's not really anything bad to it, but that's far from the truth. But when you're hurting, people want to feel better, and so they're looking for something to take to help this inflammatory or this chemical type of pain or that mechanism of it. So one thing that I would say as a guideline is if you take medicines like NSAIDs, these Advil, these kind of medicines that work in that pathway, non-steroidal anti-inflammatory drugs, that you likely will benefit from taking omega-3 fats, commonly referred to as fish oil, because the body's own production of those anti-inflammatory chemicals is produced from fat and cholesterol type of molecules in the body. So if you take those and you get relief, but you're like, man, I don't want to take those, I would look at taking a high quality clinical grade and correct dosage amount of omega-3 fat. So I'm going to show you a couple things here. This is just some Googling, but I'm just keeping this really simple, kind of fast. Some physical signs that your body may be deficient in healthy fats: changes in the skin and hair, dry eyes, joint pain, stiffness, especially a lot of joints in the body, out my shoulder, my elbow, my ankle, my back, but a lot of things hurting without direct trauma or aware of what causes it would be an indication of that. Then you can have cognitive things. The brain is basically made of fat and cholesterol, so things can affect brain function, depression, mood swings, memory, those kind of things. So those would be some signs of it, and you could read other things, but just as an indication beyond just pain itself, if you have some of these other things, those would be additional signs in other systems of the body that there may be a deficiency of omega-3. Now, one of the questions that comes up is how long does it take for taking these type of supplements to lead to significant pain reduction? The summary of what I would tell you is that taking something like an aspirin or a drug commonly within hours might change the way a person feels, but it's terrible for you. Taking things like omega-3 have a similar clinical benefit, but it may take a few weeks to a couple months to reach that maximum benefit on par with the relief that somebody gets from a drug. I've seen people, it probably varies on how deficient that person is when they start taking it, but I've seen people certainly get pretty dramatic results at times within 2 to 6 weeks. Some people it's probably longer than that if they're more deficient or have other factors, but certainly within, it's possible within a few weeks of time that you have a pretty significant change in this, right? So that's the timing factor of it. This is a pathway that basically shows that the type of fats we get from modern diet and grain and all these kind of things there lead to what it says in red, these pro-inflammatory chemicals. This would be things that molecules that trigger pain in the body and other processes in the body. Whereas the omega-3 fats, which we're very deficient in our diet, basically come from grass and algae, and then animals eat the grass or fish eat the algae, and then you consume them, and that's the way we primarily get omega-3 fats, though you can get some from plant sources. It's just not as efficient in the body in terms of getting it into our tissues. In any case, those fats have these, are involved in the production of these natural anti-inflammatory hormones. So these are very well known pathways, and the same pathways that these drugs work by, where they call these COX inhibitors or cyclooxygenase enzyme inhibitors. These omega-3 fats tie into that, but in a nutritional way without any of the negative side effects. In fact, it'll have many, many side benefits in terms of your general health. So that's the mechanism there. Additionally, I've showed this before, but there is this known kind of longevity factor with omega-3 fats as well. So places where the diet is very, very low in omega-3 fats, they have a higher mortality rate for cardiovascular-based disease, at least. So places that have more healthy levels of omega-3 fats have a lower cardiovascular disease rate. So in addition to how you feel, this might impact your either your all-cause mortality or certainly cardiovascular disease. So when you're dealing with things like arterial things, vascular issues, heart issues, even brain vascular issues, things with stroke and whatnot. This is a very important nutrient. It ties into that. There's a lot of data on this kind of stuff. So just wanted to give another bit of education on this, because a lot of people are dealing with this type of problem, and if you're not aware of some of these things, most people should strongly consider supplementing with omega-3. There are some tests that you can do to test your blood levels of that, determine do you need it, and possibly retest and determine how to, when you can reduce the dosage or those kind of things. But most people do pretty well just to make that part of their routine for the majority of their life. If you have questions on testing on that, you can ask me about that. There's a pretty simple way to do that, okay? Hope this is helpful to you. If you have any questions, you let us know.